Hello, welcome to this episode of Eating Myself Healthy. I'm Sumit, and today I'm in my office. The reason is I'm going to do a Skype interview in a minute with someone quite important. The diet I've been following has been set up by a guy called Clint, as I said, in Australia, but he based it on the work of a man called Dr. John McDougall. Now, he's an American doctor who's been doing a low-fat, sort of vegan diet. He calls it a starch-based diet for 40 years. He says it cures not only what I've got, rheumatoid arthritis, but it can help cure diabetes, MS, a variety of different conditions. It can help people who have got heart problems and even help people who have got serious long-term illnesses such as cancer. I'm about to chat to him, and I want to talk to him about, not just where it comes from, but also why there is this reluctance amongst the medical community to even consider diet a part of what we do. So let's have a listen to what he says. I'm 48 years old. I got diagnosed in 2014 with rheumatoid arthritis. I had no idea what it was. My first symptoms were about probably 2 or 3 years before that, just swellings in my hand. And then when I got the news, I was told two things. One, it is incurable, and two, diet's got nothing to do with it. Can I ask you that first question? Is it incurable?
Absolutely not. It's curable. And that has been published in more than 30 papers over, probably since the 1960s. And you'll find it published in journal articles that include controlled trials that were published in The Lancet in 1991. And, other scientific letters and papers and so on. I did a review of those. It's called Diet, the Only Hope for Arthritis. I published it maybe 10 years ago. And so the scientific literature says that not only is rheumatoid arthritis caused by something in the environment, which is obviously the diet, but when you stop doing the cause of a problem, what happens is many, if not most people, get the cure. So,
is it a cure or is it just a remission? How you're a medical doctor. I never know what the difference between remission and cure is.
Let me tell you what that is. Say you have a bad cough and you are a cigarette smoker and you believe normal behavior is cigarette smoking. Then if you quit smoking, you're only in remission. See, because you think it's normal to breathe tobacco smoke. So you're only in remission. But if you're a sensible person and you understand that tobacco smoking is an aberrant behavior, which makes you sick, then when you stop that behavior, you're cured. Likewise, if you think the Western diet is normal eating, then you're only in remission. But if you understand that the Western diet, whether it be consumed in China or India or Canada or the US or Europe, if you understand that that diet is poisonous, and it causes obesity and heart disease and type 2 diabetes and constipation and colon cancer, as well as inflammatory arthritis, which is what we're going to call rheumatoid arthritis from now on. Then when you stop the aberrant behavior, what happens is you are cured. Now, if you think eating fish and chips is normal behavior, then you're only in remission. Normal human behavior, I see you're in an office, I don't know how you're making your income. But
We're a news company. We're journalists.
Regardless, you must keep the doors open.
Yes.
So when it comes to the food industry, they're just acting like human beings. They're selling dairy and fish and meat and oil. And when it comes to the medicine business, even though you have a national health system, you would think that the rules wouldn't be the same, but they are. When it comes to the medicine business, you want to sell product. And that product could be hip replacements, it could be diabetic pills, this is product, or your services as a doctor. You need to be compensated for unit value. In other words, whatever you do, you get compensated for, and the more you do, the more you get compensated. So,
hang on, are you saying the doctors are corrupt? I mean, that's a bit of a strong statement.
I'm saying doctors are human beings. Okay, so, if you put anything special about a doctor compared to a banker or a newspaper reporter, then you're naive. you're fooling yourself. Physicians are human beings. So when it comes back to the inflammatory arthritis, which you call rheumatoid, it doesn't make any difference. It's all the same. If it was psoriatic arthritis or lupus arthritis or nonspecific arthritis or rheumatoid positive, rheumatoid negative arthritis, you're all talking about inflammatory arthritis. And it's not important that you distinguish these because they're all caused by the same thing. They all have the same standard medical treatments, be they aspirin or methotrexate or biologics, same therapies. They're all told by your doctors to have nothing to do with diet. The course is aggressive and deadly for all of them. And all of them are cured. And when I say cured, there are always exceptions, but my experience is the vast, vast majority of people with inflammatory arthritis, once they stop the cause, they get dramatic improvement in terms of they stop having attacks. Now, the crooked joints that they have are not going to straighten out. Let's not be unreasonable. There will be damage to their lungs and their heart and other tissues from these inflammatory processes that are scars. They're not going to go away. But you can stop the acute inflammation. And this change begins in about 4 to 7 days after changing your diet. It's not like you have to wait for 6 years. So most patients with inflammatory arthritis, once they change their diet, let me just tell you what the diet is, and then I'll get to the details later. It's a diet based on starch, or things like rice, corn, potatoes, traditional foods that I'm just guessing your grandparents ate, and certainly my great-grandparents lived on. So you're talking about rice, corn, potatoes, sweet potatoes, some beans, peas, and lentils, with non-starchy vegetables like kale and broccoli, but these are side dishes, and with some fruits. Now, there's a special category of limitation, and that has to do with people who have gluten sensitivity.
Right.
So I would tell you that some of our inflammatory arthritis patients further have to restrict and avoid wheat, barley, and rye. And there are a few of our inflammatory arthritis patients who have to take a further step, which is called an elimination diet. And that's a lot of work, but occasionally that's what it takes to get rid of some inflammatory processes in people. But generally, a diet based on starch, even if it includes high gluten foods like wheat, barley, and rye, works.
And have you seen this happen? So you've got medical cases where people have gone on this low diet, the diet I'm on now, and they've actually cured themselves.
Well, in my May 2014 newsletter, which is at Dr.McDougall.com, I offer you 10 cases of severe inflammatory arthritis, rheumatoid, psoriatic, and I think once you read the description, and by the way, they're not just written descriptions, some of them are audio descriptions, there are audio-video descriptions. Once you finish the stories, I think you can only come to the conclusion that these people were cured.
I'm taking methotrexate. It did work. It made a big difference for me from when I first got diagnosed. So is it the reasoning is that the medical community don't think we as patients will do a diet because it is quite a tough thing to do? Or is it they just don't consider it and think that the medicine works best? Because I was told, have a lot of drugs first because they will limit the damage long term.
You're giving the doctors too much credit. You know, they simply know nothing about food and disease. Your doctor likely knows nothing about the connection between constipation and diet or obesity and diet. They have some vague knowledge out there about, well, maybe it's sugar or, some vague knowledge. They really do not understand. They don't understand the connection between colon cancer and what you put in your colon. So I think you're giving your doctors far too much credit. They went to medical school, be it in the United Kingdom or Canada or Australia or the United States. They went to medical school that was traditional. There are no exceptions that I'm aware of. And these medical schools are designed to get students to pass the boards, and they're designed for students to go into a trade. Medicine is a trade. It's not a thinking profession. It's an acting profession. So you're designed to take out cataracts or to replace hips or to dispense methotrexate. That's your job. I mean, they're preparing you for a very lucrative job. There's somewhere along the way it says something about helping other human beings, but that gets lost in the business. So they just plain and simple don't know.
I talked to my doctor, and she was like, "Look, you've got to stick to taking the drugs, and I'm happy to take the drugs and be on the diet and see if it works. And I am, I'll talk to you about what I'm doing right now. But privately, she said to me, I said, "What do you think of me doing this?" She said, "Yeah, I can't advise you that you should do this, but I'd have a go." And it seems to me that these doctors do care, and I'm sure you'd agree that your fellow professionals do care, but they seem to be conditioned to say, take the drugs.
Well, that's all they know. That's all the physicians are taught, is to use drugs or surgeries. Like, for example, in your country, coronary artery disease is treated with angioplasties and open heart surgery. But we all know, or at least intelligent people know, that this is a disease of food poisoning due to eating hamburgers and pork chops and cheese and so on. There's been a tremendous amount of research published in the British Medical Journal and the Lancet. In fact, your country has two of the best journals in the world.
Yeah.
Not that they aren't corrupted by money, they are. But anyway, this is not a mystery that food makes people fat and sick. So, first of all, your doctor was not taught this in school. When your doctor went through his or her medical school, they had fish and chips for lunch and eggs for breakfast, and it's just the way it is. It's just the way that we're taught to do.
All right,
you're assigning doctors a special place in the hierarchy next to God. Get over it.
Let's talk about what's been my journey. It's been interesting. So we are probably about 5 weeks into this, and I did Patterson to begin, which was it's different to yours. He is basically, I had just literally salad and cucumber juice first day. I mean, that was a shocker. But it's very funny how slowly you get used to it. And now, I'm not expecting a miracle, and I'm going to be monitoring myself, seeing how my blood levels go. But bread, potatoes, we're culturally thought this is going to make you fat. When I told everyone in the office I was going to be doing this, they're like, "What, you're going to put on loads of weight?" Funny thing is, I've actually lost 7 pounds. But for some people who are overweight, right, my driver is very strong for this, which is I want to heal myself. Right? I've got a life-limiting condition. If I'm not bloody motivated by that, then nothing's going to motivate me. But do you think for some people, when you say eat as much as you want, that really should come with a caveat? Because if I ate as much white bread as I wanted, or if I ate as many, chips, or even if it's baked fries, there's a slight danger in saying eat as much starch as you want, you won't have a problem.
Oh, is there?
Isn't there?
Well, I'm going to give you permission to breathe as much air as you'd like.
Okay.
I'm going to give you permission to drink as much water as you like. Is there any harm in either?
Well, I think water can be. You can over dilute your body. I mean, that's.
Oh, you do, huh?
Yeah.
You've never seen it, and I've been in this business 50 years, and I've heard about it, but I've never seen a water intoxication. But I hear it exists in some psychiatric hospital, someplace, somewhere. You get my point.
No, I do get your point.
Your breathing drive and your thirst drive were designed correctly. Why did God take a nap when he or she designed your hunger drive?
So you would.
Do you think that your creator, whoever it may be, in some fanciful world, created your stomach the wrong size or your hunger drive incorrectly? Do you think that would happen?
So our hunger drive is correct. It's just that we respond to it with the wrong food.
You got it. This is so simple. I mean, this is so simple. So let me give you the other answer to your question, is in the time of your grandfather, the only overweight people
were the rich.
The only people with diabetes or rheumatoid arthritis were the extreme upper class. Now, I just want to tell you, 2 years ago, the British Medical Journal reported that the middle class in India now has achieved the obesity and the disease of the upper class. So you still have the lower class in India that still struggles on a starch-based diet, a diet of dal and breads and rice. But your middle class is now as wealthy or wealthy enough
Yeah, I've seen it myself. The fast foods.
to attain the disease of the extreme upper class that your grandfather used to deal with.
I want to encourage people. I'm not an evangelist, okay? I admire what you do. I'm here. Sorry, say that?
Why aren't you an evangelist? You're
Because I've got to prove it to myself. I don't evangelize until I've known it's working.
You've already lost 7
Yeah.
pounds. You've already experienced symptom relief beyond anything you ever expected.
But I am still on the drugs. So I want to see that as I take the methotrexate and I can go to my doctor, and she's not that willing for me to reduce my dose, but I want to say, once I've done this for a while, maybe 3 to 6 months, can I reduce the dose and come off it? I do have that driver to believe that the positive thought makes it happen, but I need to see the science. So,
Well, you'd like to know what happens to my patients. They generally start to get better in about 4 to 7 days, and they notice noticeable benefits like you did. You have to clear the bowel of bad food first before anything can happen. So in about 4 to 7 days, and sometimes it's sooner, they'll do things like close their hands, and they'll say, "I haven't been able to do that for 4 years." Or they'll be able to pick up their baby, or something it'll be an aha moment that things are different. And it might not be 7 days, it could be 7 weeks, but who cares? But it usually starts about then. And then by about 4 months, almost everybody has achieved all of the inflammatory reduction they're going to get.
right.
But they haven't achieved the weight loss. There are people, weight loss goes at about 10 pounds a month. You lost 7. About 10 pounds a month it goes to. And then you hit trim body weight, which is maybe far less than you think. For example, I'm 6 feet tall, and I'm fewer than 150 pounds.
Wow.
But I used to be 230 pounds, and anyway, the natural way that things happen with almost all of my patients, and you can read the stories in my May 2014 newsletter, and you can read the more than 30 scientific letters or control trials that have been published. And my experience is that people get better. They start doing all the things they want. And then the next question they ask is, do I need these drugs?
Yeah.
And the only way to find out whether you need the drugs is you have to reduce or stop them. So what I have people do is they may go from 20 milligrams of methotrexate a week to, a couple of weeks later to 15, a couple of weeks later to 10. And anyway, you slowly reduce it. Same thing with the biologic agents. Maybe you get a shot a week, and then you decide, well, I'll get a shot every 2 weeks or every 3 weeks. And you can do it that way. Occasionally, my patients will just say, I've had it. I'll just stop them all.
But isn't that dangerous?
What would happen?
The inflammation would come back?
Yeah, well, what's the worst that would happen? I mean, are you going to drop dead? No. What's the worst that could happen is your pain would come back. So you'd have trouble writing. And so then what would you do? You'd go back on the drugs. And just like last time, within a few days, they'd have their effects back, and then you would understand if you went too fast. So what I would ask your doctor, if I had a chance to talk to your doctor, of course I'm not advising you because you're not my. But if I would talk to your doctor, I would ask your doctor, okay, you have patients with inflammatory arthritis who have changed their diet, and they're obviously healthier. I mean, your scale, your body weight scale shows so, and you maybe have checked their lipids, and their cholesterol's dropped an international unit, and their blood pressure's down, and they look better. So you're sitting there as a doctor, and you're saying to yourself, let's see, I've never taken a patient off drugs before in my entire life. Medical school never taught me to take a patient off drugs. I'm afraid.
Yes, and I get that fear.
If I took somebody off drugs, my colleagues would criticize me, or I might make a mistake, and the arthritis might come back, and how terrible.
I'd be sued as well. Yeah.
I don't know what your litigation is in England, but in the U.S., the doctors are. It's called fear-based medicine. You believed, I know some time ago, you believed that the doctor would also offer you medicine that would cure your arthritis, not just relieve the pains.
No, I didn't believe cure. I'd read that, you know, it's incurable. I thought manage it. But what I never thought is that, having seen the videos and now explored what you're doing, is that actually I could cure something I was told is incurable.
Right. Well, some patients go to the doctor not having had the knowledge that you and I are sharing. And they believe the doctor is going to cure them. And your doctors all believe that these are disease-modifying drugs.
Correct.
That will, and you do too, that will dramatically influence the course of the disease. However, this is way oversold, and the side effects are way underestimated, and the costs are criminally unreasonable.
Yeah.
So, you know, anyway, so we live under fear-based medicine and faith-based medicine.
What would you say to people who are watching this, or in the sort of pain that I've been in? You know, just in January, I was off the pills for a while, and I couldn't move my shot. I couldn't get out of bed. It was a nightmare. Everything came back the way I thought. You know, when you're on the drugs, you get this false sense, don't you, that life is great, and then you realise the reality bites. What do you say to people who might think this sounds good, but it's very tough to do?
What's more difficult, eating oatmeal or ordering a seatbelt extender when you get on an airplane? What's more difficult, eating rice and vegetables, or not being able to walk across the room in front of your employees because you're so crippled? It's difficult compared to what? Now, allow me 90 seconds.
Of course.
Okay. You obviously have a lot of weight to lose. All right. I told you I'm 6 foot and less than 150 pounds. I don't know your height.
I'll give it to you. I'm 5'8", and I now weigh 11 stone 6.
So that's times 14 pounds.
Yeah. 160, yeah, something like that.
All right. A 5'8" man, remember I'm 6 foot. A 5'8" man weighs about 130 to 135 pounds, which, by the way, sir, you weighed when you were 18.
I did, exactly. 9 stone 5, yes.
You have a long way to go.
Yeah.
So don't give me this stuff, I'm going to do it for 6 months. When you're 130 pounds, you call me back and you tell me how long you're going to do it. Second of all, you must remember what I said about indiscretions. You might say, look, it's not fair. I eat, and I'm not saying you don't,
sure.
but let's just throw it on the table for the other people. People look at me right in the eye and they go, I do exactly what you say. Well, you don't. There's a statement that goes way back, which I never say to a patient, and that is that all dieters are liars. So I would tell a patient who, was dying of inflammatory arthritis. By the way, within 20 years of best treatments evolved, half the people with rheumatoid arthritis are completely disabled or dead.
I know that.
All right. So we're not talking about some minor infraction of your toenails. No. Somebody comes to me and they say, look, Dr. McDougall, I really enjoy my wife, my children, my job. Just tell me what to do to get well. Well, the recommendation I would give to them is potatoes and water would be fine. Sweet potatoes and water might be even better. You mean alone? Yes, I mean alone. And we can go the whole B12 to it later. But, or they may say, look, I don't like underground storage organs, which people all through the world have enjoyed underground storage organs. I want an above ground storage organ like rice or corn.
Yeah.
That's fine. But you have to add a little fruit and vegetable because grains and legumes are deficient in A and C. So we're sitting bargaining. Not, you and I, or as a patient, we're bargaining and we're saying, look, I'm only going to do this for 6 months. Mm-hmm. But I'll do whatever you say for 6 months. Mm-hmm. When you call me up in 6 months from now, if you eat nothing, white rice would be fine. Mm-hmm. Brown would be better. But if you ate nothing but rice and broccoli for the next 6 months, you will have lost 30, 40 pounds, whatever it is we calculated, your rheumatoid arthritis will be gone. Okay? You will enjoy health that you haven't enjoyed for 10, 15 years. And you got it on film, and hopefully I'll be around in 6 months.
Okay.
And if you do what I said, and you will be off the drugs if you make the effort.
Yeah.
In a sensible manner. But you can't call me in 6 months and look like you look now and say to me, I did what you said 100%. You know, I played that game for 40 years. So call me back in 6 months.
Do you know what? That is a challenge and a half. Dr. McDougall, thank you so much for your time. I will be in touch again, and I'll be sending you the links to what we've done here today so you can see it. I really appreciate you talking to me so straightforwardly and giving your time. I know it's very precious. Thank you so much. Thanks for watching. Please subscribe to the channel, and you can follow me on Twitter @Rheumatoid Diet.